Hello everyone, I am Jom Chelsea Faye Velarde and I am a first year nursing student of Davao Doctors College. Today I'm going to be doing an assessment of the cardiovascular system. But since I don't have any background about my patient, let us first review the patient's previous medical record, and also I'm going to be checking for the doctor's order for the need to perform the assessment. That is done to verify the order. Okay, so now that I have enough background about my patient, allow me to share to you the things that I have prepared for this assessment. Okay, so the first one is the stethoscope, a BP apparatus, a centimeter ruler, and I also have prepared a rectangular card and a pen light. This is for better visualization. Okay, so I don't have a gloves here, but it is also important to use gloves for this assessment. That is to protect you and your patient. Okay, and lastly is the alcohol. So it is very important to sanitize our hands to prevent the spread of microorganisms. Okay, so now that we're all set, let us meet my patient for today. Good afternoon, ma'am.
Good afternoon.
Okay, so ako di ay si Jom Chelsea Faye Velarde. Ako di ay muhang student nurse for today, okay? Okay, so pwede na ko i-ask ma'am sa imong name?
Julia Isabel Velarde.
Okay, when is your birthday?
May 25.
Okay, tanong ko sa imong wristband. Okay. Ma'am, pwede man ako i-ask kung sa imong prefer na itawag na ko sa imo, ha?
Just call me Yami.
Okay, Miss Yami. Okay. So, what I did a while ago is I introduced myself and I asked the patient's verification, her name, her birthday, and confirm it on the wristband that she is wearing. That is done to establish rapport with your patient, and also I ask her what she wants me to call her. Okay, so that is done to verify that the assessment will be done on the correct patient. Okay, so Miss Yami, ang buhaton karon is mag-assess ko sa imong cardiovascular system, okay? Okay, so mga kuha lang hangyo sa imo ha is ibuhaton nimo kung unsa man akong i-instruct sa imo. Is that okay with you?
Yes.
Okay, so do you have any question, clarification bago ta mag-start sa atong assessment?
No.
No, okay. So what I did is I explained the procedure to the client and how she can participate during this assessment. And also I clarify if she has any question, any clarification before I proceed to the assessment. So that is done to reduce the patient's anxiety and to enhance the patient's cooperation. Okay, Miss Yami, okay lang ba sa inyo mag-change ta into examination gown?
Yes.
Okay, so here, change ta, Miss Yami. Okay, so now the client has already changed into her examination gown, and I also draped her. Okay, so that is done to ensure the client's comfort and privacy throughout the assessment. Okay, Miss Yami, na lang ko a few questions for you. Is that okay with you?
Yes.
Okay, so first question is, do you have any history of heart disease?
No.
Very good. Have you ever had a heart attack or any procedure you've made in the past?
No.
Okay, good. Or how about heart failure?
No.
Okay, very good. Have you experienced any chest pain?
No.
Okay, good. So since you don't have any problem with your heart, can we start now?
Yes.
Okay. Okay, so now I'm gonna be assessing for the patient's neck vessels. I'm starting with the jugular veins. Okay, so now in doing that, I'm gonna be standing on the right side of the patient, and I'm gonna, while the patient is in a semi-Fowler's position. Okay, so that position, I'm gonna be elevating the head of the bed to 30 degrees while ensuring that the head and the torso are on the same plane. Okay, so Miss Yami, I'm just gonna raise the bed. Okay, is that okay with you?
Yes.
Okay, so this position, the semi-Fowler's position, relaxes the neck vessels and allows better visualization and access to the client's precordium. Okay, so now I'm gonna be instructing the patient to turn her head slightly to the left, and I'm gonna shine a light obliquely onto the patient's neck to observe for pulsations and shadows. Okay, Miss Yami, would you mind to turn your head onto your left side? Okay, good. Okay. Okay, so the pulsation of the right-sided external jugular vein is observed, and a diffuse pulsation of the right-sided internal jugular vein is observed. Okay, so upon observation, the veins are not visible, which indicates that the right side of the heart is functioning normally. Okay, so remember that if a jugular distension was noted, remember to assess for the jugular venous pressure by locating the highest visible point of the internal jugular vein. Okay, in doing that, I'm gonna use a pen light for that. Okay, Miss Yami, tanaw ta sa left side na to. Okay. Okay, so if necessary, raise and lower the head of the bed until you can see the highest visible point of the internal jugular vein. Okay, so now I observe the highest visible point of the internal jugular vein, and I'm gonna measure it by using the rectangular card and a centimeter ruler. Okay. Okay, so the jugular venous pressure is 3 centimeter above the sternal angle with the head of the bed elevated to 30 degrees. Okay, so now repeat the procedure onto the other side. Okay, so now I'm gonna be assessing for the patient's carotid artery. Okay, so still on the semi-Fowler's position, I'm gonna instructing the patient to tilt her head slightly to the side being examined, and I'm gonna be palpating for her carotid artery. But remember to avoid too much pressure or massaging the area. Si Yami, tanaw ta diri sa right a bit. Chin up. Side, doon sa left. Okay, so upon palpation, there is a symmetric pulse volume with full pulsations, and trusting quality, and also an elastic arterial wall, which is perfectly normal. Okay, so now I'm gonna be instructing the patient to turn her head slightly away from the side being examined, and I'm gonna be using a stethoscope for this. Okay, and I'm gonna be placing the bell onto her carotid artery, while asking the patient to hold her breath for a while, and I'm gonna be listening for breaths. Okay, Miss Yami, turn na to atong head sa left. Okay, inhale ta, exhale, and then hold. Okay, tanaw ta sa right, inhale, exhale, and then hold. Okay, so there is no sound heard on auscultation, which is perfectly normal. I could only hear the pulse. Okay, so now I'm gonna be assessing for the patient's heart, or the precordium. Okay, so still on a semifowler's position, and I'm gonna be inspecting the chest wall for abnormal pulsations. Okay, I'm gonna be shining a light over the cardiac apex, and to make the movement of the pulsation visible. Okay. Okay. So remember that for women, keep the right side of the body draped. Okay. Miss Yami, kuha na to ni. Okay, so I didn't see any suspicious at all. I could only see normal respiratory movements. Okay, so now I'm gonna be inspecting the patient's precordium for pulsations while palpating the aortic, the pulmonic, the tricuspid, and the apical area. Okay, I'm gonna be palpating for heaves and lifts using my palm, and for trills, I'm gonna be using the ball of my hands, and I'm gonna be checking for the for buzzing or vibratory sensation caused by the underlying turbulent flow. Okay, so now I'm gonna be palpating for heaves and lifts using my palms. Okay. First is the left second interspace, the aortic area. Next is the right second interspace, the pulmonic area. Okay, so right next to the sternum, the fifth intercostal space, the tricuspid area. Okay. Finally, the midclavicular line in the fifth intercostal space. Okay, for trills, I'm gonna use my the ball of my palms. Okay, the aortic area. And then the pulmonic area. Okay, the tricuspid area. And the apical area. Okay, so good. None are observed here or anything of concern at all. Okay, now I'm gonna be palpating for impulses using my finger pads from the aortic area, the pulmonic area, and the tricuspid area. Okay, palpate ko, ma'am, ha. stomach area. Tricuspid area. Okay, so still none are observed here or anything of concern at all. Okay, so now I'm gonna be palpating for the patient's apical impulse using the palmar surface of my 3 middle fingers, and then I'm noting for its location, diameter, and amplitude. Okay, for finer assessment, use 1 finger in palpating, but if unable to palpate the apical impulse, roll the patient onto her left lateral side. But if you still cannot palpate the apical impulse on that side, ask the patient to inhale fully, exhale fully, and then hold it for a few seconds, and then palpate again the apical impulse for pulsations. Okay, so now I'm gonna be palpating the apical impulse using the palmar surface of my middle fingers. Okay, palpate ko, mama. Okay, now using my 1 finger, okay, so if unable to palpate it, ask the patient to roll on her left side. Okay, Miss Yami, roll to sa left side. But if you still cannot palpate it, ask the patient to exhale and then hold. Okay, Miss Yami, exhale and then hold. Okay, so the point of maximal impulse is tapping. It is 7 cm lateral to the mid-sternal line in the 5th intercostal space. Okay, so now I'm going to be inspecting and palpating the epigastric area at the base of the sternum for the abdominal aortic pulsations. Okay, so I'm going to place my 3 middle fingers on the patient's 3rd, 4th, and 5th interspaces. Okay. 3rd, 4th, 5th. Okay, so good. I don't see anything of concern at all. Okay, so now I'm gonna be auscultating the patient's apex while listening to the rate and rhythm for a full minute. Okay. So I'm going to be placing the diaphragm of the stethoscope onto the patient's apex. Okay. So Yami, auscultate ko ha. Okay, so the heart rate is 70 beats per minute, which is normal and with a regular rhythm. Okay, so now I'm gonna be auscultating the patient's aortic, pulmonic, tricuspid, and apical area for heart sounds, extra sounds, or murmurs. Okay, so in doing that, I'm gonna use a diaphragm and a bell of the stethoscope. But first, I'm gonna use the diaphragm of the stethoscope. Okay. Okay, Miss Yami, I'll just do a regular breathing. Okay. Okay, so the S1 and the S2 are heard, which is the lub dub. There are no clicks, murmurs, or any extra sounds elicited on the aortic, the pulmonic, the tricuspid, and the apical areas. Okay, so now I'm gonna do the same thing with the bell of the stethoscope. Okay. Okay, so I heard the S1 and the S2. I did not hear any extra sounds, and I did not hear any murmurs. Okay, so now I'm gonna repeat the preceding steps while the patient is in her left lateral position, in her sitting position, and while the patient is leaning forward, and briefly stop breathing after exhalation. assessing for the patient's peripheral vascular system, starting with her upper extremities. I'm gonna be assessing each arm for the size, symmetry, skin color, and temperature from the shoulders to the fingertips. Okay? Okay, Miss Yami, mag-touch ko ha. Okay. Hold ko lang ni. The other side. Okay. Ako. Okay, so as I observed, both arms are equal in size with symmetry and uniform in color. The shoulders to the fingertips are warm and no presence of edema nor lesions. The hair distributions are equal on both arms. Okay, so now I'm gonna be assessing for the peripheral veins of the patient. I'm gonna be checking for the presence and the appearance of superficial veins when the limbs are dependent and when limbs are elevated. Okay? Okay, Miss Yami, may I touch you again? Okay. Okay. Please flip it. Okay, so in a dependent position, there are presence of distension and nodular bulges, and when limbs are elevated, the veins collapse. Okay, so now I'm gonna be palpating for the patient's radial, ulnar, and brachial pulse. Okay, so Miss Yami, I'm just gonna palpate. First is the radial pulse, just under the thumb. Okay, the other one. Okay, now the ulnar. Now the brachial pulse. The other side. Okay, so as expected, the ulnar pulse cannot be palpated properly, while the brachial and the radial pulse are 2+ and symmetry. Okay, so now I'm gonna get the patient's blood pressure. Okay. Okay, so blood pressure of 100/80, which is normal. Okay, so now I'm gonna be assessing for the patient's capillary refill. Okay, so Miss Yami, touch po sa. Okay, so good. There is an immediate return of color in 2 seconds. Okay, so now I'm gonna be performing the Allen test to check the patency of the radial and the ulnar. Okay, so in doing that, I'm gonna ask the patient to clench her fist tightly. Okay, so Miss Yami, can you please clench your fist tightly? Okay, then open, then close. Okay, So now I'm gonna place my both of my thumbs on the radial and the ulnar pulse. Okay. Clench tightly. Now open. Okay. Now I'm gonna remove the pressure on the ulnar pulse. Okay. Okay. Now clench again. I'm gonna remove the pressure on the radial pulse. Okay, open. Okay, the other side. Clench your fist tightly and then open. Then close. Okay. I'm gonna remove the pressure on the ulnar pulse. Open. Okay. Again, close your fist. Okay, I'm gonna remove the pressure on the radial pulse. Okay, open. Okay. Okay, so good. Pink coloration returns to the palms within 3 to 5 seconds. Okay, so now I'm gonna be examining the patient's lower extremities. While the patient is in supine position, I'm gonna be assessing each leg for size, symmetry, skin color, and temperature of from the groin to the toes. Okay, Miss Yami, I'm just gonna move your blanket. Okay. Okay, Miss Yami, touch ko ha. Okay. Okay, so the lower extremities of the patients are warm and no edema palpated, and also no abnormalities seen at all. Okay, so now I'm gonna be assessing for the patient's peripheral veins for appearance and the presence of superficial veins when limbs are elevated and when limbs are dependent. Okay, so in doing that, I'm just gonna place a folded blanket on the patient's legs. Okay, Miss Yami, can you please raise your legs? Okay. Okay, now I'm gonna get it. Okay, so in dependent position, there are presence of distension and nodular bulges at calves, and when limbs are elevated, the veins are collapsed. Okay, so now I'm gonna be palpating for the patient's femoral pulse, popliteal pulse, dorsalis pedis, and then the posterior tibial pulse. Okay, so first is the femoral pulse. Okay. Next is the popliteal pulse. Okay. And next is the dorsalis pedis. And next is the posterior tibial. Okay, and let us proceed on to the other side. The femoral pulse. Okay, so now the popliteal pulse. And now the dorsalis pedis. the posterior tibial pulse. Okay, so the femoral, the popliteal, the dorsalis pedis, and the posterior tibial pulses are 2+ and symmetric. Okay, so now I'm going to be assessing for the patient's peripheral leg veins for signs of ulcerations, varicosities, and thrombophlebitis. Okay, so Miss Yami, I'm just gonna touch again your legs, okay? Do you feel anything?
No.
Okay, good. Okay, so good. No varicosities or stasis changes. The calves are supple and non-tender and are symmetric in size, and also no redness or swelling over the vein sides and no edema palpated as well. Okay, so now I'm gonna be assessing for capillary refill for both legs. Okay, so Miss Yami, I'm just gonna pinch slightly. Okay. Okay, so good. There is an immediate return of color in 2 seconds. Okay, so now we are down to our closing phase, and in this phase I'm gonna be informing the patient that the assessment was done, and I'm gonna be assisting her to change into her new clothes. Okay, so Miss Yami, we are now done with our assessment. Okay, so pwede na ta mag-change sa ato ang sanina, ma'am. Okay.
Okay.
Okay, so now that the client has already changed into her clothes, I'm gonna be summarizing the findings that I have gathered during this assessment, and I'm gonna be discussing if any health concern is present, and also I'm gonna be assessing the patient's understanding, and ask if she has any concern, any clarification before I end the assessment. Okay, so Miss Yami, so far I didn't see anything of concern at all. No problem with your jugular veins, your carotid arteries, your lower and your upper extremities. Okay, so do you have any question and clarification before I end the assessment?
None.
Okay, so do you understand what I said? Everything about the assessment? Okay, so good. Okay, so Miss Yami, thank you very much. Thank you for your cooperation. Thank you for being so cooperative. Okay. Okay, so Miss Yami, if you have any concern, just address it directly to the doctor. Okay.
Okay.
Okay, so thank you very much. We're gonna get going now. Okay.